Folks, we have a poll question that we'd like you to fill out today. We'd like you to select the role that fits you best. So just pick one, and if none of those first ones apply, go down to the bottom and you'll see that the last one says other, please describe. I know many of you, as you signed in and shared where you were from, you also shared your role, which we appreciate because we capture that information and we have a better understanding of who's in our audience. So thank you so much. Got some state government professionals, TNTA professionals, CCDF administrators, direct service professionals and practitioners. Wonderful. I notice we have some pediatricians as well, an early childhood chapter champion. Yay. Childcare licensing. Wonderful. Okay, I'm going to give you just about 20 seconds to wrap that up, and then we're going to go ahead and move forward. Thank you for sharing your role with us, and that way we have a better understanding again of who's here. We'll share the results very quickly so that you can see we have several CCDF administrators. We have direct care professionals, practitioners, an early childhood chapter champion, early Head Start, family and community members, pediatricians and state government professionals, and lots of TNTA folks. Good to have you here. All right, folks, we're going to move on and we're going to get started with our webinar today. I would like to thank you for joining us. And on behalf of the Office of Child Care, I want to welcome you to today's webinar. We are an Office of Child Care Technical Assistance Center. The National Center on Early Childhood Quality Assurance supports states and community leaders and their partners in the planning and implementation of rigorous approaches to quality in early care and education settings for children from birth through age 12. NCECQA is funded by the U.S. Department of Health and Human Services, Administration for Children and Families. The presentation slides from today's webinar will be made available to participants within 2 to 3 weeks of this webinar, along with the recording. I do want to acknowledge and thank all of you that submitted questions for today's webinar. If we do not get to them, we will try to make sure that you get a response. We did get quite a few questions, and I really appreciate that. And for those of you that did say you may have interest in the community of practice, we will be touching on that towards the end of this webinar today, and we'll give you more information in case you would like to sign up to be contacted for that community of practice. Our objectives today are to review the impact of the pandemic on reducing access to developmental screenings, learn about the importance of increasing access to developmental screenings, resources, and services for all, and hear about examples of current state developmental promotion and screening initiatives. So we're going to start out today by just revisiting the importance of developmental and behavioral screening. As many as 1 in 4 children through the age of 5 are at risk for developmental delay or disability. If developmental concerns are caught early, we can help ensure that children receive the support they need and that they are linked to the appropriate services. As a result of the pandemic, children have demonstrated increased social and emotional needs, and the pandemic resulted in a decrease in the number of children who received screening services and potentially increased need for these same services. Recently, I had the pleasure on being on a call with Dr. Womack. She really brought the importance of developmental screenings during this difficult time into focus. Dr. Womack is an early childhood chapter champion from Idaho. And we're going to ask her to start us out today. Dr. Womack, will you please share why this is so important now? Tatiana, do we have Dr. Womack on the line?
Yes, I do see her in here.
Let's make sure she's unmuted.
Hello?
Hi, Dr. Womack.
Yay, sorry. Sorry about that. I couldn't unmute. So
Not to worry.
as Jean said, I am a pediatrician and I am the early childhood champion here in Idaho. Currently, I am in my school-based clinic and there's tons of Omicron right now. I'm sure it's the same where you guys are. So Jean asked me just to lead us off for a few minutes talking about the
Oh, I've lost audio for you.
Okay, am I back?
Yes,
So
you sure
sorry.
are.
Technical difficulties. I'm in a school doing my school-based clinics today. So anyway, I was asked by Jean, my friend, to open us up today to the why of what we're doing. And I don't know about you guys, but sometimes it does feel like I'm rearranging deck chairs on the Titanic. We have such a monumental task and we can only do so much. And just to bring that home, last fall, my parent organization, the American Academy of Pediatrics, along with the American Academy of Child and Adolescent Psychiatry, the Children's Hospital Association, as well as the US Surgeon General, declared a national emergency in pediatric mental health. And I'm sure this does not come as a surprise to any of you. COVID-19 and the pandemic it's caused has been called the new ACE. And I'm sure all of you, because I know I looked at what your positions are all across the US, you're aware that adverse childhood experiences, especially the more you have, can directly lead to half of the top 10 leading causes of death in the United States. And certainly this COVID pandemic can be considered an adverse childhood experience. Last fall, I saw a number, 140,000 children who have lost their primary or secondary caregiver, and that's just not okay. But the research on ACEs, as significant as it was then followed by even more important research on what we do about ACEs, and that is these protective factors. And protective factors can look like events, they can look like people, such as coaches, teachers, of course, caregivers, that promote a person's healthy development and buffer the effects of adverse childhood experiences. There's been a lot of talk about resilience, and my favorite definition of resilience is the ability not just to bounce back from adverse situations or experiences, but to bounce forward from them so that when you come out the other end, you are actually better off, not just in spite of, but because of the things that you have experienced. Next slide, please. So what I want you guys to think about as we go through this next hour together is that one of the important protective factors that increases resilience and decreases the incidence of child abuse and neglect, as shown through evidence, is developmental screenings, is developmental monitoring, and promoting this with families so that they regularly monitor their child's development. Next slide, please. So many of you are familiar with the Strengthening Families framework and the 5 protective factors within them. One of the protective factors is knowledge of parenting and child development. So understanding child development and parenting strategies that support physical, cognitive, language, social, and emotional development. So if you remember nothing else about my short time with you guys today, remember that you guys are on the front lines of what I hope is going to help all of us bounce forward from where we are today and change a lot of these terrible statistics and increase the resilience of the families and children that we serve, simply by promoting developmental monitoring regularly by families and caregivers and doing these screenings ourselves. And with that, I'm going to turn it back to Jean.
Thank you so much, Dr. Womack. I so appreciate your time here today, and especially that you stepped out of the school clinic to help us out. I really appreciate all that you do for children and families, and I look forward to working with you again soon. So as we continue with this conversation, we want to think about the importance of strengthening families we talked about as a protective factor. And as we think about moving forward, the importance of learn the signs and learning the signs to act early, I was gifted with a slide from our friends at the Association of the University Centers on Disability. They were kind enough to provide us with a slide today to share information on the Learn the Signs Act Early ambassadors. And so I'm going to share that with you very briefly, but I want to make sure that you have the opportunity to see that. Now, 41 sites have received 2-year grant funding to provide support for early childhood state systems through the Act Early Network to support recovery and strengthen resilient skills, behaviors, and resources of children, families, and communities during COVID-19 response, mitigation, and recovery efforts. To learn more about this effort, we will provide a link in the chat box for you. If you have not yet connected with a site in your state, consider reaching out for more information. The Act Early ambassadors support their state work toward identification of developmental delays and disabilities using the Learn the Signs Act Early program. To find your Act Early ambassador, there will also be a link in the chat box. As a reminder, the slides will be sent to all participants within the next 2 to 3 weeks. So now we're going to move on, and we're going to, as promised, get to hear from some of our states. Joy, are you able to unmute?
Yes, ma'am, I am. How are you doing?
Oh, so glad to hear your voice. I am doing well, ma'am. How are you?
No, doing better than I deserve.
So I had the pleasure of meeting Joy for the first time just a few weeks ago, and we thought we were going to have a half-hour talk, and I think we could have gone on for what, 4 or 5 hours, Joy?
Yes, ma'am.
It was such a pleasure to talk with you about your work. My first question to you is regarding your integration of the Ages and Stages questionnaire in childcare in Alabama. I understand that programs earn points for implementing a screening tool for all children. Would you share more about how that works and tell us more about that in Project Hope?
Yes. So in Alabama, we are on a continuous improvement plan for our quality rating and improvement system, which means as a state, we are making sure that our QRIS system is not only giving us our quality ratings, but also moving our programs into constant state of improvement. And so this year, as we've revamped our QRIS system, we have added screenings as part of a element of our rating system where a program earns points to get higher star ratings. And one of those screenings is that we ask that programs use the ASQ and the ASQ-SE, and we do offer additional funding so that they are able to purchase the ASQ and ASQ-SE as a screening tool. our work with Project Hope also was a focus on implementing a universal screener in our highest need counties. And we focused on 3 of those counties. And what we found is that our pediatricians were not aware of the technology that the ASQ, that the screeners do bring. And so we have been working with our pediatricians in these high need counties to tap into the enterprise system. We do like using the enterprise system as it's a great source to pull data from, but also it allows the questionnaires to be given accurately and to be scored accurately. And so we don't have that human error piece, but we are linking funding now through our QRIS system to using the ASQ screeners in their programs as a measure of quality.
And so that's part of your child care development fund funding that you have?
Yes, and we've also braided PDGB5, the preschool development grant, birth to 5 funding. And we've also braided some of the early Head Start Child Care Partnership funds as well. So we've done a lot of work with braiding our dollars to ensure that, that our quality programs hit as many providers as possible. And in this case, it's statewide. So we're quite proud of that.
That's wonderful. And I know one of the things that really was exciting for me as someone who's worked with the pediatric population as well as worked with childcare population for my career was to hear that you were working with both to educate them and have them have access to the enterprise system where they can actually have the developmental screening information right in front of them. So Joy, the ASQ enterprise system itself for screening completion is used by the early care and education program and the pediatric programs, but it's also used by home visitors, correct?
That is 100% correct, yes.
And is training available for all these audiences as well?
Yes, so we do offer in-house training, of course, for our team. And then we also offer trainings outside of the department that they are able to access, and our quality contractors who are funded through the Department of Human Resources. And I work for the Department of Early Childhood Education. They are also funded. And I think that's the biggest piece is when we sit down as a group, it's linking all of the state agencies together. And that has been something we have really worked hard on through the award of the PDGB5 grant, is building an infrastructure where state agencies that used to work in silos are now sitting down and talking to each other. So Department of Public Health, Department of Early Childhood, Department of Human Resources, Department of Mental Health with the ASE, we all are sitting down and having conversations to agree on a single tool. So that way, when we're having conversations, we're all speaking the same language and we're not saying, wait, one more time, what tool is that? Let me go look that up. It becomes a tool that we're all speaking from the same language. And when we're dealing with things like early intervention, and even with school systems, when we're referring children with an IEP, having that singular language has been very beneficial. And we're going to continue to keep building that in our state.
I love to hear about systems that are working together, and the fact that you have braided funding, and not only have you thought about, you know, the not working in silos, but actually working together in ways in which you can do that and link to each other. It's just so wonderful for us to hear about. So Joy, you told me a little bit about the early Head Start childcare partnerships, but I know that they use both ASQ3 and ASQ social and emotional screenings in these programs, and you actually have things like coaches and quality specialists. Can you tell me a little bit more about that?
Yes, so this is another phenomenal partnership that we have in our state. The Department of Human Resources is actually the Early Head Start Child Care Partner grantee. The Department of Early Childhood Education is the contractor, if you want to call us that. We do all of subpart C of the Head Start performance standards, and we monitor quality for all elements of the implementation of the program. So this is another place where we are able to braid dollars to make sure that quality is being implemented. We have a very unique EHS-CCP program in our state. Half of our programs are childcare and half of our programs are family childcare. And that has been, I've worked now as the director of this program for going on 5 years. And it has been eye-opening working with family childcares, especially using screeners. But all of our children are assessed at enrollment and at the beginning of each program year with the screener. And then based on the screener results, referrals are made to EI. Now, why we love this as coaches and teachers and people in the field is if when a parent completes it at the home visit with the teacher to help the parent complete it. So it's done in the presence of the teacher at the first home visit. That way, if there's any questions, the teacher, who has been trained by us, is able to answer it on the spot. What's great is that we can then say, from the information you gave us, we see there's a concern in language. There's a concern in social. And what we have found is it builds stronger partnerships because the parent's voice is not muted. And we are able to move with those ASQ and ASQ-SE screeners to get help for the child, but also link the family to resources much quicker. And when we started, at one point, we had a debate, and I'll just talk about it because we learn a lot from debates. We had a debate in our state that the parent fills it out, and then we give the child 4 weeks in the program for opportunity, and then the teacher reassesses. Well, I didn't feel comfortable with that because we were muting the voice of the parent. So what we've done now instead is the parent completes the screener, and referrals are made from that based on the parent's concerns. Now, if the parent has a concern that their 18-month-old is not writing their name correctly, that is still a referral or a conversation. And a referral just means they're linked up either with a service provider or a family provider who's able to work with them and to talk them through if this is a concern, a true concern, or one that is just a parent education piece, which has been phenomenal. Then at 4 weeks, we bring in the DECA, and the DECA is completed for all ages as a follow-up to the SE. The ASQ-SE. And you're probably asking, well, why do we do that? Well, the ASQ-SE is a screener and the DECA is an assessment tool. From the DECA, we have a mental health referral. And we are doing something brand new this year as well. A year ago, we invited our coaches to go through a year-long certificate program through a university. They actually earned a certificate in early childhood mental health. We had 4 coaches go through the program, and they have now become hybrid coaches. They do mental health training. They provide mental health, indirect mental health support, and not direct support. And then we have a licensed mental health consultant who is on our staff full time. And she, of course, directs them. And we have so much coming up this year. We needed extra hands in the field. What we have found is that when we gave our coaches a trauma-informed lens to coach through, our whole coaching model has shifted this year. So we are actually opening this up to our other coaches. Just from our data from the ASQ-SE, from our intake data, we noticed that there was a higher need of mental health support, of course, through a pandemic. And so this has actually changed how we coach. And it's one of the things I'm most excited about because it actually is almost a 2-generation approach to coaching where we're looking at the whole family. and not only what the child needs, but what does the family need? And that in the EHS partnership, of course, Head Start always looks at the family. So we have truly been challenging ourselves to figure out how to use the ASQ data. And we do that through the enterprise system. And we pull those reports monthly. And from those reports, we're able to build in-service training for our teachers that targets the immediate needs of the children coming in. And so like we just had in-service for our teachers in this EHS partnership, and the trainings were based off of the ASQ data. In other words, the children coming in, we're seeing low levels in this area. So we're going to train you in higher strategies. And by using that data real time, we're able to impact the children we're serving in real time. So we are huge fans of the enterprise system. Goodness, sorry.
All good information, Joy, and we so appreciate you sharing. I know Mercedes, I saw that you had your hand up, and I can't unmute you, but if you would type your question in the Q&A, we will try to make sure that Joy has an opportunity to see what your question was. And then the last thing I would say is, Joy, do you want to just share a little bit about your Pathways Homeless Shelter Emergency Childcare? Because I think it's so exciting to hear about.
We are, it took us 1.5 years, but here's what we are doing. We have a homeless shelter in our program that is serving children who meet the HUD definition of homeless. So these are children living in cars. These are children living in shelters. These are children who are formerly displaced. And we have opened up an emergency child care program for them. We might have these children 2 days, 2 weeks, 2 months. It is no questions asked childcare. So I've worked homeless before, and we've asked our parents to be part of improvement programs and things like that. This is literally enroll your child. We go through all the state vaccinations. The child is enrolled as in a formal licensed childcare, but we do not ask you where you're going, what you're doing. You do what you need to do. Just bring us your children. This program is, like I said, it took us 1.5 years to navigate all the legalities of it. But one of the biggest pieces is to secure funding. I need data. And the ASQ is how we do data. So they receive the ASQ at enrollment, and then they receive the ASQ3 at every age interval. So why this is so important is when my infants come in, they get those ASQs at their intervals, 2 months, 4 months, 6 months, right? If they come in older, their intervals are a little bit wider, but at least I'm able to get that data at the intervals, because our hope is when they leave us, all that data is exported from Enterprise and follows them, hopefully, to a permanent placement. We have had the program running, and we have had children come to us for 2 weeks, disappear for a month, and then come back. And that we are able to pick up right with those ASQs. Why do we use the ASQs? We have created lesson plan templates, and we use the strategy guide provided by ASQ. And that is how the teachers build lesson plans. Every child has their own individualized lesson plan. They do not do such as, snowball fights, those sort of things. It is literally, the teachers are trauma informed. They're trained in the ASQ. They're trained in the DECA, and they implement a lesson plan based on the exact data of that child. And I've never been able to say in 25 years of early childhood, what curriculum do you use? The child. But in this program, how we have created it, the child is the curriculum. And what better way to do that than with very vulnerable, high need kids? And the ASQ provides us a wonderful foundation to build activities that strengthens that child literally where they need it the most. So it's phenomenal.
So exciting to hear about the things that are happening that we don't get to hear about every day. And Joy, I can't thank you enough for being part of this call today. And I know we could talk for a lot longer, but we have 2 more exciting presentations to get to. So thank you so much, Joy. Your time is so valuable to us.
Thank you so much.
So now we're going to move to a presentation from Dr. Isaacson from New York. Dr. Isaacson, we just talked the other day and we kind of caught up about some things that you were working on, and just so excited to have you speak today and share your story and explain what's going on in New York, and especially with Docs for Tots. So Tatiana, can we unmute Dr. Isaacson?
I think I'm unmuted. Did it work?
Wonderful. There you are.
All right. I always worry at the last minute whether it's going to work or not. So hi, everyone. I'm Liz Isaacson, Executive Director of Docs for Tots. And Docs for Tots is a nonprofit in New York State. And we're the only pediatrician-led agency that works with everyone who can set kids age 0 to 5 on a trajectory to thrive throughout their lives. So who do we mean by everyone? We need parents, we need health providers, education providers, childcare providers, policymakers, you name it, business people. We want to talk to you. We want to talk to you about kids 0 to 5. And I wanted to start with this slide because this is I'm sure many of you have gone to collective impact conferences and things like that, but this slide is what Dr. Tots sort of thinks about all the time. And I know we've all been in meetings and been in situations where we look what's on the left side of the slide, the disorder and confusion. Everybody's got projects, but nobody really knows what's going on, and they're all going off in different directions. Oftentimes we function at a level of individual impact. So that means that, we actually all have our individual plans, like Docs for Tots has a strategic plan, and, everyone has their own strategic plans, but they're kind of going off in different directions, and they're not coordinated at all. And so when you can get really far, you get to coordinated impact. And that's where you've got all kinds of different community and state agencies and everything moving in alignment. At least we all have the same North Star. We have the same goal. And then what we'd love to get to, which we've struggled with, and it's really hard to achieve, but that's collective impact. And that's really with collaborative action, meaning that whatever one agency does actually leads to better outcomes in the other agencies. We're all working together. So that's my nirvana. That's where I'd like to be. I think all of us would like to be there, but I always like to put that as a setting because it helps us be like, okay, where am I? And certainly for different work that I do, I could plot it on different areas of that arrow. So go ahead, next slide, please. One of the major programs that Docs for Tots runs, and I'm not going to go into it too much in detail right here, is Help Me Grow Long Island. I saw on the chat that there are some other people from, I think, Help Me Grow Washington. So hello, fellow Help Me Grows. This is just some data that I wanted to share with you. It's historical, and I think it starts to give some of that COVID impact that Dr. Womack was talking about. So these are our referral patterns for our Help Me Grow Long Island. In 2019, you don't need to see the small things. What you need to see is that the big blue area was healthcare providers. We used to get 64% of our referrals from healthcare providers for our Help Me Grow. That went down to 24 in 2020. And in 2021, it snuck back up to 41. And what this is it's literally a visualization of what kids didn't experience in 2020. They didn't get to their well child visits. They perhaps didn't get the monitoring and the screening in their pediatrics, and therefore they weren't getting referred to us for linkage to, early intervention or CPSE or other services. Then the other color I want you to look at really quick is the purple. So the purple is actually referral from friend and family, meaning that, your aunt told us about us, or your neighbor told us about us, and you needed to call because you were concerned about your own child. And you can see that in 2019, before the pandemic, it was only about 7% of our referrals. It went to 23 during the pandemic because people didn't know where to turn, and they didn't have, a lot of places weren't, answering the phone because there was no one in the office or the phone had changed. So they found out about us through word of mouth. And now in 2021, that's gone down a little bit, but it still remained, at 10%. And I like that data because I think it tells the story of what parents experienced in 2020 with young kids. Next slide, please. And then this is also 3 years of changing issues for families. So again, you only need to look at 2 colors. One is the tealish blue. I'm not very good with colors. And the other one is orange. So teal blue is developmental concern and orange is basic needs, food, diapers, cash, referral to SNAP and WIC and other things like that. And you can see the change in the pie. And that, to me, when we think about strengthening families and building resilience, we have to remember the impact that poverty has. And some of the most vulnerable families were made even more vulnerable during the pandemic. And it's important that we always screen and we always do developmental monitoring, but it's also important that we're there with those basic needs supports in families in time of need, because parent knowledge and parent of child development is a strengthening family pillar, but so is access to services in the time of needs. So love that. And I'm sorry, I've been ignoring the chat, but hello, all of Help Me Grow. I saw Texas and California. So hello, everyone. I like those 2 slides because I think it grounds us in what the families with young children have experienced the past 2 years. Okay, next slide, please. All right, so I'm actually going to talk about the Learn the Science Act Early ambassadors because Docs for Tots was one of those 41 different states that received some money to work on Learn the Science Act Early during the pandemic. And we called our activity New York Acts. I wasn't directly involved in it. Melissa Passarelli, who works for Docs for Tots, she's our director of programs, is one of the ambassadors, and a fellow pediatrician, Dr. Romina Barros, is the other ambassador, but they work very closely. And obviously I oversaw some of this work, but it was really exciting. And I'm not going to dwell so much on developmental screening because Learn the Science Act Early is not necessarily, ASQ and screening, but it's really about developmental promotion and what we have to do as state leaders, as agencies that work with families across the state, and to give really solid, coordinated messages about development to families. And the success of this is that many people are continuing to work on this through this year, and we've actually integrated these activities into New York State's early childhood comprehensive systems. So not only will this 2 years of funding fund this Learn the Science Act Early work, but we've actually put it into ECCS, so that'll continue for 5 years. So it's a really good thing. Okay, next slide, please. All right, so this is my pride and joy. Now, there's some state people and all people from all different kinds of lines of work, but look at all of these departments. So the New York State Department of Education, the New York State Department of Health Insurance Programs, that's who oversees our Medicaid. New York State Department of Health, their home visiting project, the Children's Institute, Rochester Grow. So that's like a community, but a pretty big community in New York. Help Me Grow Onondaga, the Office of Children and Families Child Care. So OCSF has 2 arms. And of course, they didn't participate together. They participated separately, but at least they both participated, child care and welfare, and obviously our ECCS team. And I'm just so proud of that. I know to an outsider, maybe that doesn't look like an amazing list, but we had all of these agencies participate, and they continued to participate all year. Like, they came to meetings. It was amazing. So next slide, please. And the real goal was across New York State, everyone should be using the same messaging to promote child development, right? You don't have Coca-Cola advertising in New York one way and advertising in Alabama a different way and advertising in Utah a third way, right? No, we advertise about a product the same way. And I know that sounds a little crass, but when we talk about development, we should be talking about it in similar ways so families are getting consistent messaging across all the different services they may interact with. So in our first 12 months of this, we trained over 700 providers across all those different agencies about the Learn the Signs Act early materials. We distributed over 10,000 Learn the Signs Act early materials, and I can attest to this. They came through our front door and went out our back door, and it was painful. 6,000 children's books, a 33% increase in the download of the CDC's milestone tracker during those 12 months. I can't claim exact results from that because it was no way to link it, but there was an increase of downloading of that tracker. And it was really the first time many of these state agencies promoted child development using the Learn the Signs Act earlys and intentionally embedded them into their systems. And you can see we have a couple quotes from the different people we worked with, but the idea of monitoring and the idea of promoting parental knowledge of development is a job for all of us across all of our agencies. Okay, next slide, please. So that's our take-home messages. I'll sum it up this way. I think I'm a minute over, so my apologies. Maslow's hierarchy of needs, right? It matters. During the pandemic, we didn't get a single call about my kids not, I think that my child's speech delayed. They were thinking about different opportunities, and we need to be able to meet families where they are during that time. However, as they call with a problem, there are opportunities to promote development. And they're as important as early identification of delay. A unified messaging matters, and that agencies change. They can actually embed new materials into what they're doing. And one of the things I really took home is we didn't tell any of these agencies what to do. They came up with their own plans and they figured it out themselves. And it's led to more sustainability because they weren't told what to do. They solved the problems themselves. Okay, so I think that's it. Any more slides?
No, I believe we're moving on to the next one. But before I let you go, I do want to ask you, you were so good about acknowledging who was in the chat. We have a question that came in, and I don't know if you can help with this one or not. But I'm wondering if we could put it in the chat box. Tatiana, could you take the Q&A question and put it in the chat box? And if Dr. Isaacson, you feel like you can respond to it, maybe you could respond to it in the chat box since we are short on time. Would you mind?
Not a problem at all.
Oh, wonderful. Thank you so much. I so appreciate you. And Steve,
Okay.
are you unmuted?
If you can hear me, I am.
I hear you. I'm so excited.
Oh, great.
Great. Thank you for joining us from Utah. And if you would go ahead, I'll just move your slides as needed.
Okay. Well, thanks for having me. And thank you for such valuable information, Noreen and Joy and Dr. Liz. And it's wonderful to see Maslow hierarchy of needs survive all the times and changes. That is critically, important. And we preach that all the time here with our groups. So yes, my name is Steve Matherly. I work for the Utah Department of Health, and I've been asked to present on our early childhood integrated data system and how it interacts with our ASQ enterprise account and data systems, and some ramifications and aspirations related to COVID-19. Next slide. I'll definitely just high level this. We've spoken a lot about ASQ today. It's a screening tool, looks at various developmental milestones and domains, and the questions change as the child gets older. We've spent a lot of time on this today and talked about ASQ, and so we can go to the next slide. All right. What's specifically to Utah Department of Health? We have an ASQ online enterprise account. We enroll many community-based programs, various care types, such as pediatricians and community health clinics, Head Start, child care providers, preschools, universities, Help Me Grow, local health departments, home visiting providers, state McVie funded as well as community-based home visiting programs, our early intervention, our Part C program, and others. At any one time, we have a couple hundred accounts, historically speaking, and at any one time, we have about 60 active accounts. We started about 10 years ago with just a few hundred screens from our partners at Help Me Grow, and we've evolved to, over the next 10 years, we hit a peak in 2019, hitting around 15,000 screens. Typically, we're between 10 and 15,000 screens annually. But it's just great to note that, like I said, in 2010, we had about 100 screens from Help Me Grow, and annually they turn in about 3,000 screens contributed to our account. So they're just an amazing partner. With regards to COVID, like I said, we hit our peak of screens contributed to the account, to our account from the community-based partners, just over 15,000 screens in 2019. And then we dropped to 11,000 in 2020. And I just pulled some data, and we're down to 10,732 in 2021. A good example of this, as you know, COVID has impacted the way programs operate. And of course, they've had to prioritize their service delivery. And of course, that rings true for our local health department. So we had one health department that also contributed about 3,000 screens annually, and now they're down to about 300 a year over the last 2 years. It shows a direct impact of COVID. Proud to say our Help Me Grow continues to contribute about 3,000 screens to our enterprise account, even throughout COVID. And even with these decreases, we did see a slight increase with our ASQ social emotional in 2020 and 2021. All right, next slide. Okay, our enterprise account, it's a wonderful tool. You can get some great reports out of Brooks enterprise accounts. And as folks have talked about, it's a great way to get your hands on some collective data. But it comes with some challenges. The child identities can be duplicated within one program or across screening programs. And if you have more than one enterprise account, identities can be duplicated across those enterprise accounts. And for our systems work here in Utah, for grant applications, for community needs assessments, we really need to get out a distinct count of children that are being screened by one or by more than one program. And are those children, what kind of other services are those children receiving? Okay, so next slide. So we integrated our ASQ enterprise account with our early childhood integrated data system, which we call eKids. Within our eKids, we have vital records, birth and death registry data from the Department of Health, and WIC, and early intervention part C, which is called Baby Watch in Utah. And we have in our eKids, we have service summary data from all these programs, including McVie home visiting. I mentioned our ASQs integrated with our integrated data system. We receive child care subsidy data from our partners at the Department of Workforce Services, and we're just now bringing on our Head Starts. Our first one was Centro de la Familia de Utah, and we're working on DDI Vantage and early intervention and early Head Start provider in Utah. Utah has only 12 grantees, and we're lucky there. And they all but one use the Child Plus system. So we're hopeful we'll be able to bring in all of the Head Starts into this system over the years. Next slide. So this is a visual of what I just explained. It's a national visual that I've kind of customized for Utah. Just once again, an early childhood integrated data system can answer questions that you can't answer just with data silos. It gets at program crossover data. We have WIC, Vital Records, Help Me Grow is a great ASQ contributor. We hope to receive their care coordination data over time, home visiting, child care subsidy, and ASQ. So next slide. So this represents just that ASQ box. As I mentioned earlier, local health departments, early intervention providers, child care, home visiting, Help Me Grow, Head Start, universities, pediatricians, pre-K, community health centers. They all have sub-accounts within this enterprise account. We can bring that into our eKids, and now we can produce some statewide data and nice graphics and visualizations, and we can break that data down by county and by zip code. Next slide. And we present this data. This data is accessible on our Early Childhood Integrated Data Portal website. We have some data here that's publicly accessible. There's a link in the last slide. I'll have a link if you'd like to go to it and look at it. It's ecids.utah.gov. Our community assessment tool is public, and some of our eKids and ASQ reports are protected because there's so much information there. It's de-identified and it's aggregated. You can disaggregate it, but there's just so much data there that we protect access, so we know who's accessing the system and how they're using it. And the data sources govern access to that data, the data sources that I mentioned earlier. So next slide. This is an example. I know it's kind of small and it's not, you don't really have to get into the numbers. This represents about 5 years of data, 15 through 20, but it's just a snapshot. We don't have time to, usually I would do a tour of the website, but this is just a snapshot of one of the reports that we can pull that shows us the distribution of screens that are given amongst the various intervals. 36 month, 2 month, all the way up to 5 years old. Are we screening children at the various intervals? And that's what data like this tells us. And then of course, how many were above or monitoring or below cutoff. And we do this for ASQ3, which this is here. And we can also do it for ASQ social emotional. Next slide. Once again, just a snapshot from our database. We can get at how many children have been screened by a single program and how many children have been screened from multiple programs. This happens to be a pie chart with percentages, but we can also look at the numbers there, just exactly how many children have been, distinct children, been screened from a single or multiple programs. Next slide. Now this is a bigger report. This is an eKids report. So this shows ASQ as a whole. Those other reports were showing you breakdowns by the various screening programs. So this is, and so far everything that I've showed you represents the children, under 6, of course, for the ASQ. But this slide represents children under 6 as well. Over 5 years, children that were able to capture identities from our vital records, our death registry, ASQ, our Baby Watch, which is the database is called BTOTS, Child Care Subsidy, Head Start, Centro de la Familia de Utah, home visiting, their legacy database, as well as their new database, Penelope, which is also a third-party database, and ASQ is a third-party database, but we're still able to integrate that data into our eKids. And of course, WIC, a very significant partner in our eKids, as well as linking families and children to many services. Next slide. This is the same. This is the program crossover data. It's very valuable data. It tells us out of all the children that had an ASQ, how many are also participating in IDA Part C, Child Care Subsidy, Head Start, home visiting, etc. And then conversely, you go to the bottom, how many children receive WIC that also receive Part C, Child Care Subsidy, how many have received a screen. That's really good data as you work on your systems. I know many of you have PDG grants as you work to improve your systems. This is great data to have. Next slide. This is a visual of what I just explained. So everything, we have numbers, then we have visuals. If you were in the website, you'd be able to hover over this and see counts and percents. Next slide. Okay, hey, as soon as you launch something like this, it's already outdated, right? You work on these things for 5 or 10 years, you get it out there, and you already got to start thinking about next steps. So we now have the ability to also disaggregate this ASQ data and our eKids data by, like as I mentioned, zip code and county, but we can also break it down by race and ethnicity and by gender and by very specific ages. I mentioned the reports that I showed were under 6. Now we can do, under 3, under 4, this kind of thing. And we're also bringing in frequency and dosage data, not just before what I showed you was enrollment and exit data. We're very excited to bring in attendance, frequency dosage data. That'll help us. So we're already developing reports, show us if families, if we're truly engaging families in the work, are they attending our programs? And we know that data will have great implications for our research as well. Our next steps is to establish multiple enterprise accounts. So for example, our state education agency will have one, and the Office of Child Care here in Utah, and the Head Starts and Help Me Grow, so that we can really expand our screening efforts and screen more children. And our next step is to be able to take this data through, I saw someone typed CHARM in chat. That's another database that we have at Department of Health that deals in child level data. It moves child level data around multiple approved databases that approved providers have access to. And we hope to also export this ASQ data using CHARM to electronic medical records, have an interface with our immunization database as well. And we also hope that data from the multiple enterprise accounts will continue to flow into our eKids. Our overarching goal is to share this early childhood data and our ASQ data with the state's statewide longitudinal data system, Utah Data Research Center, so we can engage in impact and outcome research. Next slide. What type of difference did early intervention make in the lives of these children and developmental screening? And that's our ultimate quest. And there's a link to the website and our program and our email. That's all I've got.
And Steve, before I let you get away, are parents aware that data regarding their children or family is being integrated across the different government social programs and agencies?
Yeah, that's a wonderful question. As you know, the ASQ, it's done in partnership with early care and education, agencies. And then, so yes, the caregivers work with the parents so they understand the use of their data. And every screen that's done online, we have a very explicit consent agreement that really explains how we use the data and how it is integrated and used for research and program evaluation purposes. And in the future, we will obviously have to revise and adapt those agreements to accommodate using this data operationally, meaning everything I showed you is aggregated and small cell size suppression, et cetera. As we move towards using this data operationally amongst various agencies, then our consents and disclosures will even have to be more explicit.
Great. Thank you for sharing an answer to that question. And we did have someone who asked that in the Q&A, and I am sorry we did not get to all the Q&As or all the questions in the chat, but we will take those back to our presenters and ask them if they could provide us that information so that we can share it with all of you, because I know that you had some really great questions. And I can't thank our presenters enough today for everything they were able to share with us. We do have some resources that will be included in the slide deck, but I do want to let you know about this upcoming event, that of in expanding developmental screening initiatives, community of practice. And so we are going to put a poll up, and some of you went ahead and actually shared information when you registered, but we'd like you to have the opportunity to, if you're interested in joining a community of practice on expanding developmental screening initiatives, you can share that here. We'd like to get an idea of what our numbers look like so that we have information as we move forward to kind of design this appropriately, whether we need breakout rooms or whatnot. It is designed to help states, territories, and tribes bring together health, early care and education, child welfare, and other human services and family support program partners, as well as community leaders, families, childcare providers, and other stakeholders to achieve agreed upon goals for thriving children and families. So we will be working with multiple partners. We hope to have, this is something that's kind of unique for this particular one, where we will have child welfare, early intervention be invited, as well as the child care community and child care leadership, absolutely. So we wanted to just kind of give you the opportunity to know a little bit more about that. It will be coming in the next couple of months. We will be sending out information. And I just wanted to thank you for today for all of your participation, and want to move us to the last of the slides that we have, our contact information. If you want more information and didn't get a question answered, or you want to contact us for more information about developmental screening, technical assistance, or just information about what other states are doing, please reach out to us at that email address. And you do see on your screen, there is an evaluation that we do ask you to fill out, because we really want to always be doing continuous quality improvement. And so we really appreciate your time today. Thank you so much for your time, and for all of our wonderful presenters. Thank you so much for your time and energy in preparing for this and being able to share your stories on today's perspectives from the field.